was 46 years old when I was diagnosed with cancer. I actually went for a colonoscopy. I was having some pain. We thought it was an infection, which they were treating me for, and I felt fine. The next day, unfortunately, they found a tumor. I was in surgery until 7 o'clock the next morning, so it was a long night. We didn't get the final diagnosis then, but that's when we knew, obviously, something was very wrong. About a week later, I was in Ocean Medical, and Dr. Mansell, he came in to talk to me about my results. We had pretty much known by then that it was cancer. For some reason, I don't know what it was, but I really wasn't as concerned about that. I was more concerned about my son's graduation. He was graduating from college in May. This was August. So the doctor looked at me and I said, "Am I going to be at the graduation?" He said, "I'll be there with you." I said, "You can tell the family whatever you need to tell them. And whatever we need to do, I'll do."
Our relationship that started 4 years ago, I think it matured over those years. I think it's something very unusual that Kathleen and I, patient and physician, are able to connect in a very interesting way. I think it's about healing, and it's not only me trying to put her into complete remission, which happened a few times, but also the way how she is able to cope with cancer is amazing.
It definitely changed me to have this diagnosis. I like to think that it changed me in a positive way. I don't want to say that this was a positive thing that happened to me, because it certainly wasn't. I think I look at life a lot different. I really try not to dwell on the little things. I try to make memories. It's all about memories now. It's all about what can I do to help? What can I do to get the word out there? How can I help somebody else with this disease?
She is the pillar of strength.
Mm-hmm.
She is a pillar of strength.
She's a rock.
For everyone.
She's
for
a rock
everyone.
for so many of us.
I've never met anyone, guy or girl, who is as strong as that woman.
You know, life throws you different curveballs, and you gotta
time is
kinda,
yeah. Time is precious.
You gotta live each day to the fullest.
Kathi has taught me so much about life, so much about how to live my life in day to day. You really need to not worry so much about the small stuff. And she has taught me so much about raising my sons. I'm getting a little upset, but she's taught me a lot, a ton.
I value people in my life different. There's not a phone call, I think, that I end. There's not a text or a note or anything that I end that I don't say I love you. I mean, and I mean it. One thing I've always said through this whole thing, I never received better care, ever.
I know she is thrilled that that is where her doctor is. I think that they have taken great care of her. I visited her in the hospital when she's been there, and everybody is just so friendly, and she seems well taken care of. So I'm happy that she's happy when she's there.
She needs to understand that we love her, and we're all here for her.
We want to help.
Right. We want to help. It helps us
to help her.
That staff, the nurses, the doc, everybody up there, oh my, you couldn't have asked for better care. My family was in there, and whenever they brought me something to eat, they offered my family a tray. Now, my father loves hospital food, so he was thrilled to death. Mom, on the other hand, not so much. They cared. That's my point. They cared so much about my family. The Meridian family cared about the Mead family. My family had just found out that I had cancer. They needed support, and that was huge, that they got it, not from oncology even, from people on the orthopedic floor. I don't like knowing about the end. I know that sounds strange, but there's not a lot of things to think about. Dr. Mansell's got me on all the treatments. My friends and my family get me through the day-to-day. It's worrying about what happens, and then how will my sons be? That's my big, I worry about them a lot because, that'll be that would be a huge thing. Yeah, it'd be huge.
She has this metastatic disease for 4 years. She still is able to cope. She's never complaining.
You just can't give up hope because they're always finding something, and that's why it's so important to keep active in advancing Meridian and all its systems and all that it does. I was at Blue Claws enjoying life, and on a dime it changed the next day. Because of Meridian, right in your backyard, I wound up with a doctor of Dr. Mansell's caliber, with his practice, with all the people he's associated with. I wound up with OSHA Medical Center, who did my original emergency surgery from the middle of the night, from 11 o'clock at night till 5 or 7 in the morning. I didn't have choices of surgeons. They provided me, Meridian provided me with the care that I needed. And all of you have that, and it's through the support of the donors to Meridian and to OSHA Medical and to all the hospitals that run through Meridian. Thank you for everything.